Edema is a medical term for swelling. It occurs when the tiny blood vessels in the body leak fluid which build up or is trapped in the surrounding tissues, leading to swelling or edema. It can affect any part of our body. One can notice it more in the hands, arms, feet, ankles, legs, and even the face. Depending upon the swelling location, edema can be broken down into following types. One is peripheral edema, which it usually affects the leg, feet, ankles, and hands. It could be a sign of problems with the circulatory system or kidneys. Pedal edema, this occurs when the body retains fluid in the feet and lower legs. It is more common in older one or pregnant women. But here one can find it difficult to move around due to numbness. And third type is pulmonary edema. It's the retention of fluids in the air sacs in the lungs and makes it hard to breathe. And it's worse when you lie down. If you have a fast heartbeat, feel suffocated, cough up foamy, spit blood, then immediately call an ambulance. Lymphedema is a swelling in the arms and legs that is usually caused by damage to the lymph nodes, which are the tissues that help filter germs and waste from our body. This damage occurs due to cancer or treatments like surgery and radiation. Next is cerebral edema. It's a very serious condition when fluid builds up in the brain. It can be due to injury to the head, a blood vessel that gets blocked or burst, or because of a tumor or allergic reaction. Last is macular edema, occurs when the damaged blood vessels in the retina leak fluid, which builds up in a part of eye called the macula, that is the center of the retina. So, this swelling or edema can be due to multiple causes, of which the most common cause is medication, pregnancy, or due to the underlying disease like congestive heart failure, kidney disease, or cirrhosis of the liver. So these are the common causes. Let us discuss some more causes of edema. When mild cases of edema can occur, sitting or staying in one position for too long, eating too much salty food, premenstrual signs and symptoms, being pregnant. Edema can occur as a side effect of some medication like high blood pressure medications, painkillers, steroid drugs, estrogens, or certain diabetes medications. Apart from this, edema can be a sign of symptom of serious underlying medical conditions. Congestive heart failure, then liver disease such as cirrhosis can cause fluid to accumulate in the abdomen and legs. Kidney disease can cause severe leg edema and edema around the eyes. Weakness or damage to the veins or blood vessels in the leg results in blood pooling in leg veins and cause swelling. Lymphatic system helps clear excessive fluid from tissues, which if damaged can lead to edema. Severe long-term protein deficiency can lead to fluid accumulation and edema. Allergic reactions, severe inflammation, burns, trauma, clot, poor nutrition, as well as infections can also cause edema. The symptoms of edema will depend on the amount of swelling you have and where you have it. Edema due to an infection or inflammation like a mosquito bite in small area could cause no symptoms, while a large allergic reaction such as bee sting can cause swelling on the entire arm and can cause pain and limit the arm's movements. On the other hand, food allergies and allergic reaction to medicine can lead to tongue or throat edema, which can be life-threatening. Leg edema can make the legs feel heavy and can affect walking, while severe leg edema can interfere with blood flow, which can cause ulcers on the skin. There is also pitting edema, in which there may be an indent or pit that remains for a while after pressing the skin in some types of edema. But if the tissue springs back to the normal shape, then it is called non-pitting edema, like in thyroid disease. Signs that show the presence of edema are swelling or puffiness in certain areas or all over the body. Pressing into swollen area leaves dimple in the skin. Skin covering the swollen area appears stressed and shiny. Trouble while walking, edema in the legs or feet, increased abdominal size. Coughing or having trouble breathing if one has edema in the lungs. Aching body parts and stiff joints. Mild edema usually goes away on its own, mostly by doing things such as raising the affected limb higher than the heart. While more severe edema can be treated with drugs that helps the body to expel excess fluid in the form of urine. Long-term management involves treating the underlying cause or disease of the swelling. Edema is due to allergies. One can take anti-allergic medication, or if there is leg edema due to congestive heart failure or liver disease, then that can be treated with diuretic, also called a water pill. It increases urine production, due to which the fluid from the legs can flow back in the blood. If edema occurs due to medication use, your doctor might adjust the prescription or check for an alternative medication. Apart from some home remedies can help reducing the swelling or prevent it from coming back. First is moving the affected area. Second, try not to stand for long periods without moving. Third, elevating the swollen part of the body above the level of heart several times a day. Gently massaging the swollen area can help in moving the fluid away from the area of the swelling. Compression is a wrapping the swollen area using compression stockings, sleeves, or gloves, usually after the swelling has gone down, or to prevent further swelling. Reducing salt intake, as consumption of salt can lead to fluid retention in the body, hence worsening the condition of edema. Protect the swollen areas by keeping them clean, moisturized, and free from injury. As dry, cracked skin is more prone to scrapes, cuts, and infection, they should be treated. Now, pedal edema is the swelling of the feet and ankles caused by abnormal buildup of fluid in the ankles, feet, and lower limbs. Moving on to the causes of pedal edema, there are several factors that cause swelling in the feet, knees, and ankles. Being overweight, excess body weight can cause fluid accumulation in the feet, legs, and ankles due to reduced blood circulation. Standing or sitting for long periods, muscles are unable to pump bodily fluid toward the heart while they are inactive. The buildup of water and blood in the legs can cause swelling. On the other hand, edema can be an indication of a more serious medical issue in some circumstances. Edema can be caused by a variety of diseases and conditions, including a blood clot in the leg, injury or infection. Sometimes the swelling is due to the injury or infection of the foot, legs, or ankle, and there is excessive blood flow to the affected area. Venous insufficiency, the leg veins of blood vessels are weakened or damaged in chronic venous insufficiency, and the veins obstruct the flow of blood back to the heart, causing blood to pool in the legs and result in swelling. Next is pregnancy. During pregnancy, preeclampsia disease can cause elevated blood pressure. If the blood pressure is too high, it can lead to impaired circulation and the swelling in the legs, face, and hands. Similarly, cirrhosis of liver is a condition indicating severe scarring of the liver induced by alcohol consumption or infection. This disorder is characterized by high blood pressure and impaired circulation of feet, legs, and ankles. Congestive heart failure, kidney disease, and inadequate lymphatic system. Inadequate lymphatic system of the body aids in the removal of excess fluid from the tissues. If this system is compromised, such as by cancer surgery, the lymph nodes and lymph vessels that drain an area may not function properly, resulting in edema. Severe and long-term protein deficiency. If the diet is deficient in protein for a long period, it can lead to accumulation of fluid and result in edema. So, symptoms of edema include swelling or puffiness of the tissue just beneath the skin, skin that is stretched or shiny, skin that retains a dimple, after being pressed for several seconds. Moving on to the treatment of mild edema, peripheral edema. Mild edema normally goes away on its own, especially if affected limb is elevated above the heart. More severe edema, on the other hand, can be treated with medication that assists your body remove extra fluid through the urine. Or based on the patient's medical history, the doctor will assess if these drugs are appropriately fit. Treatment of the underlying cause of edema usually the focus of long-term therapy. If edema develops as a result of medication use, the doctor may change the prescription or look for a different medicine that doesn't induce edema. Following lifestyle changes or home remedies may aid in reducing edema and preventing it from returning. Movement, elevation and massage, then compression and reduce salt intake. These all measures can help in decreasing the incidence of edema. So now we will discuss about the chronic kidney disease and its association to the pedal edema along with its causes, symptoms, and treatment. What is chronic kidney disease? The continuing and permanent degeneration of the kidney is known as chronic kidney disease. Kidneys are a vital organ in the human body. It serves a variety of purposes, including maintaining body mineral and electrolyte balance, assisting in production of red blood cell, maintaining acid-base balance, or excreting water-soluble waste. Kidneys that have been damaged lose their capacity to execute these functions. Now, there are 5 stages of the kidney disease. In CKD stage 1, the kidney is normal, but more than 90% of the kidney functioning properly. In stage 2, the kidney function mildly decreases to 60 to 89%. Stage 3, it is 30 to 59%. In stage 4, kidney disease severely decreases to 15 to 29%. While in stage 5, there is kidney failure and the percent of kidney function less than 15%. So some of the commonly observed CKD symptoms depending on the severity, swelling of the feet and ankles or edema, nausea, vomiting, lack of appetite, sleep problems, urinating more or less, diminished mental sharpness, muscular cramps, high BP, shortness of breath. Pedal edema is swelling of the feet and ankles caused by abnormal buildup of fluid in the ankles, feet, and lower legs. Edema of the foot can be caused by 2 different mechanisms. Edema forms in patients with chronic kidney disease for 2 reasons, either due to heavy loss of protein in the urine and impaired kidney function. Nephrotic syndrome proteinuria is defined as significant loss of protein in the urine along with edema. A decrease in protein called albumin in the blood results in reduction in fluid in the blood vessels. Kidneys can detect a decrease in blood volume and attempt to retain salt. Swelling or puffiness of the tissue just beneath the skin that is stretched or shiny, skin that retains a dimple or pits after being pressed for several seconds. So, treatment for edema includes addressing the underlying cause, lowering salt intake, and in many cases using a diuretic to eliminate excessive fluid. It may also be beneficial to use compression stockings and elevate the legs. Compression stockings can be used to prevent both and treat leg edema. Although good measuring and fitting of stocking can limit the risk of discomfort. So, body positioning, elevating the legs about 30 minutes, 3 or 4 times a day can help with elevating one's legs multiple times a day may not be feasible for individuals who are working. And now, heart failure and edema. Heart is the hardest working muscle that pumps about 2,000 gallons of blood daily. And your body will quickly let you know when something goes wrong with it. Heart failure can be frightening, though sounds like a heart is no longer working at all and that nothing can be done. But heart failure means that the heart is not pumping as well it should be. Heart failure can occur due to various causes such as heart attack, high blood pressure, or various types of heart disease. And diseases like diabetes and kidney disease can also weaken the heart. A person may have the following symptoms for edema: feel suddenly looking large or puffy, shoes don't fit as well they usually do, pain in the feet or legs, walking becomes more difficult, swelling anywhere in the body, unexplained weight gain. So, how does heart failure cause edema? Heart failure causes fluid retention in the body, and that leads to edema. Reducing this can some of the lifestyle adjustment that a person can adopt are reducing the amount of salt in the diet, increase or regular physical activity levels, manage stress, practice stress management techniques like medications or therapy. Talking about the medical treatment, there is no cure for heart failure, but treatment should prolong a person's life and reduce the symptoms. Medication, implantable devices, heart transplants, surgery, drinking more water would help with swelling, but a dramatic increase in water intake could make it worse. Compression stockings increase the pressure in the lower leg that would help push up the fluid. Exercise helps the leg muscles affected by edema work harder and pump back to the heart. Elevation of the legs or swollen part of the heart also helps. So in at last, it can be alarming to notice a substantial change in the body, such as edema or swelling in the feet or other parts of the body. The heart failure is a major cause of swelling. It can also be caused by other conditions. Independent of the cause, whether it is due to heart condition or recent change in medication or diet, of the swelling can be managed. The doctor needs to diagnose the cause. You can get treatment as soon as possible. Thank you.